thyroid numbers, so your T3, T4, your TSH, all that has to be within normal limits, and you have to be, obviously continue your thyroid medications. Okay. All right. Next question was differences between round 1 versus round 2 in terms of liposuction or Lipo 360, Lipo 360 BBL. So there are a few differences, and it's kind of the rule of diminishing marginal returns. So unless it's been many years or there's been a big difference in weight, typically you can remove less fat on the round 2 as you can as opposed to round 1. And the reason for that is because there's more scarring, there's more what we call fibrosis after your first round. Okay, and so then liposuction does become more difficult, and that's why I always say you never want to do a round 2 under 9 months from the prior round. Okay, you want to wait 9 months. If you can wait a year, even better, and the longer you wait, even better, but certainly not before 9 months. Okay, because there is more fibrosis, sometimes the round 2s can be a little bit more painful, but that really depends on the patient. Sometimes the patients, they don't know what to expect round 1, and so now they know what to expect, so it's not as bad. So that can vary a little bit, but it typically does seem to be more bleeding with a round 2, again, because of the scarring and the fibrosis. And that's why we make sure that the cell saver is mandatory for all patients undergoing a round 2, just in case there is some bleeding. We have that set up so that we can give some of that blood back to you as an auto transfusion. Okay. Someone asked, is there a higher risk of clots? No. In terms of clots, it's the same. Anytime you have general anesthesia for longer than 30 minutes, and as long as nothing else has changed, your risk for clots will be similar. Okay. And then they asked, do we have to transfer fat to the same areas that we did the first round? Well, no, obviously not. So a lot of times round 2s are to, some tune up certain areas, and of course you can focus it as needed. So that's kind of very, there's no cookie cutter type of surgeries, no cookie cutter for round 1. There's certainly no cookie cutter for round 2, and things can be tailored to the patient's needs. All right. All right, so there's a quick question, how long do I have to wait after BBL to have my tummy tuck? And you want to wait at least 3 to 4 months, but after that you can go ahead and have a tummy tuck. So it's different. So if you're doing the same procedure over again, so you had a BBL and then you want Lipo 360, or you had a BBL and you want another BBL, then you want to wait the 9 to 12 months. But if you're doing something different, so you have a BBL, now you need to do a tummy tuck because you had a lot of excess skin and that didn't retract as well as we wanted, then you can wait 3 to 4 months, and that will be sufficient time to go ahead and do that tummy tuck. Okay. All right. There was a question regarding lipo burns. This is very interesting. I talked about it not too long ago. The first thing that I pointed out was that a lipo burn is typically not a thermal injury, so it's not like a burn in the sense that we all think about it, as due to heat, unless, of course, the person, that you're having either vaser or laser lipo, or of course, if you follow that with, say, like the J plasma, which also imparts heat, then those are thermal injuries. Okay. But if you're doing either kind of just manual or power-assisted liposuction, then lipo burns are typically not due to heat, but they're due to being too close to the skin repetitively in an area, and you kind of devascularize that area of the skin, and then that's what people commonly refer to as a lipo burn. So the way to try to avoid that is to not remove so much fat that the skin is left so thin where you can risk that. I always say you want to try to leave at least about a centimeter of fat beneath that skin to try to protect from lipo burns. But having said that, it's always a risk. So even though I try to be as careful as possible, I've had maybe 2 in my career, and it's unfortunate. So you have to know how to treat them. So what do you do? Well, the first thing you do is if you recognize a lipo burn, then you have to not compress the area. So yeah, you have to not do the faja and the foams for, say, the first kind of 48 or 72 hours or so that you don't further compromise the area. And then we do start some treatments with a nitro paste. It's called NitroBid, and then you can use arnica gel, and also you can prescribe an oral medication which is called pentoxifylline. And typically, if you're able to catch it early and you do all these things, you don't compress and everything else, then for the most part they tend to improve significantly. Okay. All right. But the key is you want to kind of identify it as early as possible. All right. Okay. People ask about their goal weight. Should they be at their goal weight at the time of surgery? Then the answer is yes. You want to be at your goal weight, certainly around the time of surgery, and then that's kind of the weight you want to maintain after surgery as well. Okay, you don't have any big fluctuations in weight either way. Either up or down after surgery. So you want to keep things kind of within 10 pounds, before and after surgery, so that you can have the best long-lasting result. Okay, if you have a great result and then you lose 20 or 40 pounds, things are going to sag again. You have a great result and then you gain 20 or 40 pounds, fats are going to reaccumulate again. It may reaccumulate differently than it was before, but it will reaccumulate, and so you don't want to do that. You want to keep things to within 10 pounds or so. Okay, all right. Well, there was a lot of questions regarding mommy makeover. Again, if you go to the Pure Instagram, if you go to that IGTV, there's a whole segment there, Mommy Makeovers, which was done not too long ago. There's photos, examples, and we talk about all the different breast surgeries that you can do with a Mommy Makeover. A Mommy Makeover is basically a combination of a breast surgery with a tummy tuck. Of course, tummy tuck always includes that muscle repair, that liposuction to the flanks and the waist. And then the breast surgery can be any kind of breast surgery. It can be a breast aug, it can be a breast lift, it can be a breast reduction, it can be a combination aug and lift. And so those are the different combinations that you can do with the Mommy Makeover. And then also at Pure, we do what we call the trifecta perfecta, which is when you're adding a brachioplasty to that Mommy Makeover. And so that all that can be done at the same time. And we're super efficient. We can get that done very, very quickly for you, so that you're not under general anesthesia for a long time. So typically within 3.5 hours or so, which is a great time. We can do that trifecta perfecta, and you get a 3-for-1 there. Okay, of course, recovery, the more that you do, recovery is a little bit tougher, especially at the beginning. So if you're doing the trifecta, then it's going to be a little bit more difficult for you to move around and stuff like that. So you do have to walk, though. Remember, walking after surgery is very, very important to try to prevent any potential blood clots. So you just have to keep that in mind. Pain, controlling pain is important, so I definitely recommend using the Exparel for all Mommy Makeovers and all trifectas, because that way you have much less abdominal pain, you're able to move around more, it's much safer for you, and of course you suffer less. And the Exparel gives you a very nice pain relief for up to 72 hours. All right, okay. There was a question regarding overcompression, and I am a believer that if you overcompress early, that will actually lead to poor results. Okay, you don't want to overdo it. Okay, after liposuction, definitely after a tummy tuck, you don't want to do that. So after a tummy tuck, if you overcompress early, you can actually devascularize some of that skin, and that's what can lead to sometimes to some skin necrosis and wounds. So you don't want to have that abdominal binder just you like killing it where you can't breathe. You do not want to do that. You want to have it snug, but you don't want to overcompress. After liposuction, it's similar. Usually the skin, you won't have skin necrosis or open wounds, but it can lead to worsening fibrosis. Okay, if you do too much compression early, so say within the first 4 weeks, that can lead to some fibrosis and some abnormalities as how everything looks. Can lead to lumpy, bumpy appearance, and again, it's because you're causing ischemia to that skin, which has just gone through the trauma of surgery, and then that can lead to scarring and fibrosis and bad outcomes. Okay, so you definitely don't want to do that. So yes, you want to keep things snug, but you don't want to overcompress. Okay. All right. Oh, there is a video on this again on the Pure IGTV. It's a live that I had done with the ladies from My Body Contour, and you can go ahead and check that out, and you will see that there's a segment there that talks about how overcompression can be bad for you. Okay, how it can be detrimental, and they stress that you do not want to overcompress, and you want to really, really stay hydrated. Okay, you want to drink that 1 to 2 gallons of water a day, because that's going to help in terms of how you feel, but also how you heal as well. Okay, all right. Okay, there's a question about BMI limits. So the max BMI is 33.5. So that is the max BMI for any procedure. So whether it's lipo, BBL, breast augmentation, tummy tuck, whatever procedure it is, that will be the maximal BMI limit. Okay, some people ask, what's the ideal BMI for a BBL? I usually say somewhere between 25 and 28 is probably one of the most ideal BMIs for BBL, but we can certainly do anywhere as low as 22. Once you get to a BMI under 22, generally there's typically not enough fat for a BBL. There's enough fat to do some liposculpture if you want to do that, but typically not enough fat to have a significant difference in the BBL. Okay, all right. And then there was a question regarding tummy tucks and drain versus drainless tummy tucks. So I use drains for my tummy tuck. Okay, I typically use 2 drains, and like I said, they're out between days 7 to 14 or so. Now, why is it that I don't like the drainless tummy tuck technique? Well, so in order to do a drainless tummy tuck, what you have to do is you got to put multiple internal sutures to kind of close down that dead space, okay? And sometimes when you do that, not only does it take a lot more time and it makes the surgery a lot longer for the patient, and they have to be under general anesthesia for a lot longer, and therefore that increases complication rates, but also it can create what we call contour deformities, potentially if you're not very, very careful putting in those stitches. And then sometimes because you are putting a lot of these stitches, the patients have, in the longer term reaction to those stitches. So for all those reasons, I don't like to do the drainless tummy tuck. I like to use the drains. Typically, like I said, we get them out between day 7 and 14, and after that is not an issue. Seroma rates are not zero. Of course, nothing is zero, but they're pretty low. All right. Okay, and then finally, I'm going to talk about the lipo limits here in Florida. So there's a lot of questions out there, different docs doing different things, combining different procedures in Florida, and I always say that the reason that I don't do, say, like a Makeover and a BBL at the same time is because of the lipo limits in Florida. Okay, and so there are questions as to what does the standard given to us by the Department of Health, what does it actually say? So I have it right here in front of me, and I'm going to tell you exactly what it says regarding that. So here it says, in any liposuction procedure, in order to determine the appropriate amount of supernatant fat to be removed from a particular patient, a maximum of 4,000 cc's of supernatant fat may be removed by liposuction in the office setting. Okay, so the max that we can remove is 4,000 cc's, which is equivalent to 4 liters of supernatant fat in the office setting. So I showed a picture there. Supernatant fat means that the actual fat itself. It does not refer to the fluid or the blood. So it is only the fat, but of that fat, 4 liters is the max, okay? That's the max that we can do in the office setting. If you want to do any more than that, you have to go to the hospital, and you have to do that in the hospital setting. Okay, so what does the next one say? All right, it says here, and I'm reading, liposuction may be performed in combination with another separate surgical procedure during an operation under the following circumstances. Okay, when combined with abdominoplasty, liposuction may not exceed 1,000 cc's of supernatant fat. Okay, so they specifically said with a tummy tuck, you cannot remove more than 1,000 cc's of supernatant fat. But then it also says when liposuction is associated and directly related to another procedure, the liposuction may not exceed 1,000 cc's of supernatant fat. Okay, so when you're doing another related procedure, again, it cannot exceed 1,000 cc's of supernatant fat. And then lastly, it says major liposuction in excess of 1,000 cc's of supernatant fat may not be performed in the remote location from any other procedure. Okay, so basically, it's a very long-winded way of saying that if you're doing any other procedure, whether it be a breast aug, a tummy tuck, a breast reduction, or anything else, you cannot remove more than 1,000 cc's of supernatant fat, okay? And those are the rules that are handed down to us by the Florida Department of Health. However, if you're not adding the other procedure, so if you're doing only liposuction or liposuction and fat transfer, or say liposuction and body tight, then yes, you can remove up to 4,000 cc's of the supernatant fat. All right. Okay, everybody. Well, that was awesome. We got through a lot of the questions there. I know I didn't get to all of them. There were some specific questions about liposuction, and I want to kind of do kind of a more kind of detailed segment on that. So I believe that's going to be our next live. We're going to do kind of a detailed live just regarding liposuction, what to expect.